I'm Will Grover, Vice Chairman of the Board and Chair of the Governance Committee of Physicians for Peace, an international nonprofit that helps people help themselves. Working in developing countries, we train local medical professionals in high-impact areas of healthcare, enabling communities to access care and services that we take for granted. In 2011, we had a defining, transformative moment. During a board retreat, the director asked, "What are we best in class in?" After an engaging conversation, he challenged us to prove it. That challenge set in motion a series of bold and innovative, board-generated and resourced initiatives that have had a dramatic impact on our mission. Ron Sconiers, our CEO, will explain.
Our first task was to invest in an external evaluation and gather important data about our impact on those we train, their patients, and the communities we serve. The evaluators found that our model is relevant, responsive, and adaptable to the complex environments where we work, and that our training approach is highly effective in filling healthcare training gaps, empowering local healthcare providers, improving patient outcomes, and addressing local healthcare needs. Recognizing that continued evaluation was critical to our ability to make strategic, programmatic decisions, the board also funded a full-time staff evaluator. Now we could prove it, better position ourselves for funding sources that demand that level of proof, and arm ourselves with information we need to refine our programs and services. And this was just the beginning.
With the evaluation results in hand, the board was now ready to make some significant process and organizational improvements. We challenged our committees and the staff to adopt Jim Collins' concept of big, hairy, audacious goals, setting a clear and compelling unifying focus to serve as a catalyst for success. And the board embarked on a deliberate transformative process by launching and investing in an intensive multi-year, multi-front initiative to strategically and innovatively move the organization forward.
First, the board reassessed our vision statement and developed core values to serve as the compass for our way forward. Then, knowing we had such powerful qualitative and quantitative data and the financial support of the board, each board committee was refocused. For example, the development committee has begun coaching fellow board members as to how to reach out to prospects and donors using our powerful new evaluation results. It also engaged an outside consultant to conduct a thorough audit of the development department and recommend ways to actively engage donors to partner with us in pursuing our shared vision. And the Marketing Communications Committee now has the tools and the evidence-based research to confidently generate streamlined, consistent messages to all our stakeholders. And our Medical Operations Committee, which oversees our programs, can now take the data to its trusted partners and begin to literally franchise our training model, empowering even more collaborative and decentralized program management. And finally, and perhaps most notably, the data generated from our ongoing evaluations offered the opportunity to develop a more results-driven strategic plan with an operationalized core purpose, core values, and vision, broad-based measurable strategies, prioritize initiatives to ensure the plan would be coherent and seamless, and finally, a balanced scorecard approach to measuring our performance in economic and social impact, sustainability, and capacity building.
What separates good organizations from great ones? We believe it starts with self-examination. From the moment we accepted the challenge to prove it, we embarked on a game-changing transformation process. What we learned was that to best steward our limited resources to meet global health needs, we cannot just be content with the status quo. We must continually ask ourselves, what can we do better? And how can we truly be great at carrying out our mission? When we answered those questions, we unleashed a tidal wave of new actions, decisions, and practices which propelled us forward. And importantly, the board didn't just ride the wave, but was decisively engaged in driving the decisions, making investments, and empowering committees and staff. We've made bold decisions and are becoming an even stronger organization, empowering healthcare teams who can eliminate needless suffering in developing regions. With a strategic vision and the analytical tools to make and assess critical decisions, we are poised to reach even more people in need.